Hi, and welcome back to your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Today, I wanted to give you a little bit of information about GI testing, gastrointestinal, or stool testing, you might have heard. So there are a couple things that we look for when thinking about why would we do a stool test? Is it necessary to go through that, collecting the child's stool, and is it necessary to pay the money to do it? So I want to give you a little bit of information so you can make an informed choice for your child. We've talked before about the really important connection between the brain and the gut, also known as the gut-brain axis. Now, when the gut is in a state of overgrowth or dysbiosis, so imbalance, we know that that affects brain chemistry, and brain chemistry certainly is going to affect things like behaviors. So what are some of the things that can be caused by an intestinal overgrowth or imbalance, or sort of an unhealthy microbiome? Well, for one, insomnia, bedwetting, picky eating, poop smearing. I hope you haven't experienced that, but if you have, we'll talk about that a little bit. So there are many reasons why you might want to investigate what your child's digestive system is doing. And one of the best ways to do that is to do a stool test or a GI test. Many times the underlying cause or underlying contributor to certain behaviors in our autistic kids might be a gut imbalance. Well, how do you know if you should do a stool test? We talked about oat tests. That is one of the first tests I will order on many kids with autistic diagnoses. Now, other reasons why you might want to order stool tests for your child, autistic or not, if they're having reflux issues or gas, bloating, constipation, diarrhea, any kind of GI symptom, of course. But many times, because there's this really important connection between our brain and our gut, even things like mood disorders or meltdowns, tantrums, can have its root cause in the gut. Maybe there's an overgrowth of something or an imbalance. Maybe there's not enough of the good bacteria, for instance. And I was mentioning poop smearing before. Did you know that that's a sign of possible Clostridia overgrowth? So Clostridia is a bacteria, and when it overgrows, one of the symptoms that it can cause, which is very strange, is poop smearing. And there are many children with autism who do this. They smear poop on the walls. So what can this test tell us? Well, it can tell us about levels of good bacteria and bad bacteria in our guts. Is there a balance between the two? Is the good bacteria keeping that bad bacteria at bay and preventing it from overgrowing? Do we have any parasites, bacteria, yeast, fungi, viruses, even things like H. pylori? Do we have any of those things overgrowing in the gut? It can also tell us about levels of inflammation. So give us clues to, are we feeding our children things that are causing inflammation? For example, there are specific markers for gluten sensitivity on there. It can also tell us about if we're getting enough fiber. Something called short chain fatty acids, particularly butyrate, is really important. It can tell us how much of that is in our gut. And that usually comes from prebiotic fibers, mainly vegetables, but you can use supplements as well. And the butyrate is the #1 fuel for the cells in our intestines. So that butyrate is what feeds the cells in our intestines. It can also tell us if there is any digestive insufficiency. So enzyme deficiencies, like with the pancreas, so are we digesting our proteins well? Is there excess fat in the stool, which might signify that the child is having trouble breaking down fat and not absorbing those really important fats. And it can also tell us about stomach acid levels, and when we are swallowing our food, do we have enough acid in our stomach to be able to A, kill pathogens that are inevitably going to come into our mouth, and B, enough acid to kind of have that process start of digesting and breaking down the food. It can also tell us, lastly, if there's any blood in the stool. Now, you might think that's obvious to know, well, I would see blood in the stool. However, these tests test for occult blood, or blood that you would not see with the naked eye. So one thing to remember when testing is if your child has been constipated or you are seeing blood in the stool, that might not be the best time to collect, because of course we know that that is going to be positive then if we can see it. So it's not all that helpful. So wait for a time to collect until your child no longer has visible blood in the stool, if that's been an issue for you. And one last thing that this test shows us is about gut permeability. You may have heard the term leaky gut. So that very, very, very thin one layer of cells that is between the lumen, or the insides of our intestines, and letting things into the bloodstream, into the body. That one layer of cells, is that intact? Does that have good integrity? Is it doing its job of blocking things that shouldn't be absorbed from becoming absorbed? So there are also really good leaky gut markers. So depending on the company that the provider uses to order the stool testing, it can take anywhere between at least a week usually, and sometimes up to 2-3 weeks for the results to come back. The results are usually sent to the practitioner via a portal or something else, secure and private. And then they'll usually give you a call or contact you and ask you to either come in for an appointment, or these days maybe Zoom, and go over the results. The results are very, very detailed, and there's a lot of explanation that's beneficial. If you look at these tests yourself, it's very unlikely that you'll be able to understand them or know what to do with them. And so it's really helpful to have a provider, usually the person who ordered it for you, who can really sit down with you and explain those results, and then come up with a plan of action based on what those results are showing. Cost. Cost is always a consideration with any of the testing or treatments that we do. If you have been at this for any amount of time, you know that it can be an expensive proposition to do some of these therapies or testing. So I always like to be upfront with my patients and with you about cost. The GI stool tests are typically going to run you anywhere between about $150, and if you pay the full cash price and insurance pays nothing, maybe up to about $350, $360. Now, I always recommend filing with the insurance companies. If the lab does not do that for you, you always can get a super bill from the labs with their different codes on it, and you can actually then submit to the insurance company. You probably will be required to pay the lab ahead of time, which is fine. You can even use your HSA card for that, or FSA. But definitely try to submit to insurance for reimbursement, even if they don't pay you back. Maybe it counts toward your deductible, and then you're out less money later on, so it helps towards meeting your deductible. Two of the companies that I trust most when I'm doing stool testing are Genova Diagnostics and Diagnostic Solutions Laboratory. Genova's test is called the GI Effects, and Diagnostic Solutions Laboratories, or DSL's, test is called the GI Map. So you may have heard of these. Both of these are really good, and each of them has different benefits. So it's wise to find a practitioner who understands stool testing and the microbiome and understands which test might be appropriate to order. There's a lot of overlap between those two tests, but there are some different features. And so whichever one you order is probably going to be useful, but there may be some markers that you really want to focus on that one test has and the other doesn't. Thanks again for joining me today. I hope you learned a little bit about GI or stool testing today. Whether your child has overt gastrointestinal or tummy symptoms, or you're just having bothersome symptoms like insomnia or bedwetting or gas and bloating, constipation, diarrhea, whether it's GI related or not, stool testing can really be helpful in helping you to gain insight about what is going on in your child's gut, and therefore helping you to determine, is the gut the root cause of some of those bothersome behaviors, and can you help them? Once again, thank you for joining me. Please remember, always be gentle with yourself. You're doing a great job.